Are you a new dentist or are you a seasoned dentist? Whatever the case, are you confused with the pricing of your treatments? RCT कितने का होना चाहिए, इम्प्लांट कितने का होना चाहिए, स्केलिंग का क्या कॉस्ट होना चाहिए? If you are confused, this is the right video for you. Hello friends, this is Dr. Kunal Banka and today I am going to talk about the pricing strategies in your practice. Whether you are a young practice, a medium stage practice or an advanced stage practice, there has to be a strategy in place for pricing. And what is that? Number one, your prices should not be influenced by your neighbors. If your neighbor is doing an RCT for 2000, you should not do it for 1800. Okay? Your price should be what you are spending on your treatment. It should be based on that. What value you are giving to the patient, it should be based on that. Now, how? First, for example, you are deciding the price for RCT. First decide the cost factors. What cost you are going to incur. Number one, the materials. Number two, the endodontist salary or the payout to the endodontist. These are the two major expenses in your endo treatment. If you are doing it yourself, then only the cost of material and also the money what you are going to pay to yourself for that treatment. That is your fee. That has to be added in the endodontic treatment. Two of the major factors: cost of the material used, cost of the operating doctor, be it endodontist or be it you. Then, post-endo restorations. Usually, we save a lot of money by using cheap post-endo restorations. I have seen a lot of temporary restorations done after endo or a lot of bad restorations. Post-endo restoration, take enough amount for fiber post and a composite restoration. Okay, that is your cost. On top of that, you have to add the amount, at least that much amount which is required to repeat the treatment if in case that point comes, if your treatment fails. That money should not go out from your pocket. So that is the basic pricing strategy, and then you have to decide how much profit you want to make on that. Because you have paid for the material, you have considered the payment for material, you have considered the payment for endodontist, you have considered the cost for post-endo restoration. Then you have also taken into account the cost for contingency if the treatment has to be repeated. At least once you should be able to repeat the treatment without draining your pockets. And then comes the profit for the clinic. All these factors should be added up to decide the cost of one treatment. Not only for endo, for every other treatment you can calculate it like this. Cost of material, cost of doctor, payout to the doctor, cost of repeating the treatment, cost of post-treatment procedures, cost of your profit is equal to the price of your treatment. This is the formula which you should follow, which will always bring you success. Never ever think that my cost is so much so patients won't come. My neighbor is doing it for just half the price. Don't worry friends, your neighbor is going to repent for that, because if you are cutting the price by cutting the quality of the treatment or by cutting your own profit, it's going to bite back very badly. Another question so many dentists ask me: how to increase the prices? How much price should be increased? Well, there is a rule for it. Number one, for all the treatments which are done very regularly, patient gets it done twice a year, like scaling, you should not increase the price. Keep a fixed price, 1500 or 2000 or 3000 or whatever you're keeping. Keep it fixed. But all those treatments which are like not very regular, like a patient doesn't get endo done on a regular basis, a patient doesn't get implant on a regular basis, all those treatments tend to increase by 10% every year. Otherwise, you will fail in front of inflation. Because the implant companies silently increase the cost of their implants, the lab silently increases the cost of their lab work. Why are we not increasing our prices every year by 10%? That is the formula, guys. Follow these 2 points. Decide the cost of the treatment based on your expenses and what savings you want, what profits you want, and increase the cost of treatment 10% every year. that is going to strengthen your practice financially. So guys, happy hunting, happy treating the patients, and happy price setting. Goodbye.